So I'm going to be performing my integration videos on Miss Sally Smith. She's a 26-year-old female with a diagnosis of acute pneumonia. She's been in the ICU for 2 days and she's been transferred to our unit. I'm assuming care of the patient from this point forward. So I'm going to go ahead and start first with doing my head to toe and my vital signs in the same video. So I'm going to go ahead and start. My patient's been moved to the room. I'm going to introduce myself and perform my Kiwis, wash my hands, and I would then go ahead and proceed to put on my gloves. Okay, so I've got my gloves. So I've introduced myself to my patient. I've let her know who I am. She has MS and she's bedridden, so I know that she cannot move, that she cannot get out of bed, but she's alert and oriented and is able to respond to me with some difficulties, being that she has a trach. She also has a PEG tube, and we're gonna do our videos on that later. Okay, I'm gonna go ahead and start. I'm gonna start with doing my vital signs first. That's usually the first thing we do when the patient gets to the floor. So I'm gonna put on my gloves. I'm gonna lay her down flat. And at this point, I will go ahead and I'm gonna start with the blood pressure. I would use my blood pressure cuff. Obviously, it's not gonna fit around my teddy bear, but use my blood pressure cuff, take her blood pressure, of which we got 120/70. Her respiratory rate is 32. Her pulse that I'm gonna take a radial pulse. And we got 100. And then her temperature is 97.9 degrees Fahrenheit with her O2 sats of 89% on 30% FiO2. So we know that she's gonna need some suctioning. Okay, now that we've got her vital signs done, we're gonna go ahead and proceed to the latter part of her head to toe assessment, and I'm gonna focus mainly on her respiratory. Okay, so for starters, I'm gonna go ahead and palpate her scalp. Scalp feels normal. Hair is thick and full and brown within normal limits for the patient's age. I can go ahead and assess her ears, looking in to see if there's any drainage. And there's no drainage. As I'm doing the entire head to toe, I'm assessing her skin, especially I'm going to focus on her buttocks area and her heels and elbows, areas of where pressure ulcers can really originate because she's bedridden. Once I've done that, I'm assessing the skins. I see no moles, no lesions. I'm gonna go ahead and assess her eyes. Eyes are reactive and they constrict and dilate. Reactive and they constrict and dilate. And I'm gonna come in forward, bring my pin forward towards her nose. Okay. The sclera is white and moist. Eyes are not dry, don't seem dry at all. So I'm gonna check her nose now. There's no drainage there, no scarring. And then her mouth, I'm gonna smell her breath. I'm going to assess her gums. Looking at the teeth, they're nice and pink. I can go ahead and assess her cranial nerves. My patient's face is symmetrical. I'm gonna assess her cranial nerves. I can have my patient smile, puff out her cheeks. I will let her sniff some alcohol to test her olfactory for smell cranial nerve. And then all cranial nerves are intact. So I'm going ahead and move down and I'm gonna palpate her lymph nodes, of which those are nice and normal. And again, I'm still assessing her skin using my ABCDE. And I'm also gonna assess my patient's pain using the OPQRST method. She states that she's in minimal pain, about a level 5 on our notes and our orders. There's no pain level here. So I'm just gonna say she's at a 5 in pain, but she is showing a need to be suctioned with her trach. Okay, so now that I've got her, I'm gonna lay her, she can stay like this. I'm assessing her extremities for any edema, Again, I'm looking at those elbows. There's no skin breakdown. I see no signs of any wounds, of any decubiti. So we can go on down, and I'm gonna go ahead and perform her respiratory assessment. So I know I'm gonna start one side, down, down, down. Okay, so we're gonna go ahead and listen. Lung sounds are showing rhonchi. Being that my patient does have pneumonia as well, then I can go ahead and do it on the backside too. Now I'm gonna also go ahead and assess her cardiac, her heart sounds. I'm gonna go ahead and start at the aortic. Gonna move on over to the pulmonic. Come on down to the Erb's point. Tricuspid. And then mitral. And those sounds are normal as well. Okay, so now I've listened to her lung sounds. Her pulse ox was 89%. She's have some labored breathing. Respiratory rate is at 32 again. So I know my patient's having some respiratory distress. I'm gonna move on down to the legs. Looking for any signs of edema. There's not. I'm gonna look at her heels to see if there's any pressure ulcer there. There aren't any, which is good. Okay, so then I can turn my patient on her side so that I can take a better look at her posteriorly, and I can listen to her lung sounds back there as well. So we're gonna go ahead and do that, and I'm still assessing the skin. There's no signs of any skin breakdown, no lesions. Her butt looks good. There's no wounds, no decubiti on her coccyx, which is great. Because she's bedridden, in cases like this, I can go ahead and I can decide to put some barrier cream on there to prevent any breakdowns. But we're going to continue our sounds here, and we're gonna go here. And I know on the posterior side of the patient that there's 10 lung sounds that I can listen to, which are all showing rhonchi with copious secretions. Okay, so now that that is done, I'm still looking at the skin. Skin is nice and moist, dry, and within normal limits of my patient's skin color. And that's it for my head to toe. Thank you.